Today, this is a webinar which is an in-depth review of the previous webinar recorded on AMWC Monaco 2021. Facial aging is quite commonly known to all of us here. So when you were young, look at the left photo, we get the nice V shape of youth. The cheek tissues, the nasolabial fold, and the jowls are not seen. And as we progress through the ages, you can see the sagginess, the prominent nasolabial folds, the cheek deflation, the fine lines and wrinkles. So facial aging-wise happens in all 5 layers of the face. So all 5 layers: skin, subcutaneous fat, mass, retaining ligaments and space, the periosteum, and deep fascia. So this is according to a paper, a classic and often quoted paper by Mendelsohn and Wong. This is a cadaver dissection by Professor Kotofana. We can see the compartments are discrete. So the deep fat compartments are separate from each other. The lateral soothe is separate from the medial soothe, which is separate from the deep medial cheek fats. And so these are separate compartments, and they are stuck to the bone. And importantly, take note that the roof, the retroorbicularis oculi fat, has a neurovascular bundle just beside it. And the soothe has the angular vein very close to the medial border. So be very careful when you inject fillers in these deep fat pads. So if you only had a certain amount of filler where you want to inject to get the best results, where would you put it? So Professor Kotofana gives us a clear answer: in the soothe. So you take a look here. If you inject 0.5 cc's of filler into the soothe, you get a lifting surface volume coefficient of 0.93, so which is a very high coefficient. So therefore, if you see clinically when you inject into the soothe, you always get a good lifting result. And the next would be the deep temporal fat. You can do it via a deep gunshot technique into the temple, and you can notice that it lifts up the lateral face and the jowls, and also gives you a clearer jawline. So a temple entry, so a brief guide on the graphical guide on this. So from a temple, we go in. So we penetrate the lateral orbital thickening here, and also the ZCL. At the layer 3, you feel a give, and then we aim the cannula. After we go this into the cheek, into layer 3, and then we aim it upwards towards the layer 2 at the mid-cheek region. Take a look at the arrow here. And then from then, third step, we will squeeze the nasolabial fold and the jowl fat, and I will hook the thread into the fat and then into the attachment of the dermis. So like this. So I squeeze the tissue, and then I put the thread in a wavy fashion, and there's a hook at the end. Then I will extract the cannula, and then I will drape the skin up. So this is the vector design. So the entry point is here in the temple, and the threads go down, 2 to the nasolabial fold, 2 to the jowls, and you can even put 1 also at the lateral cheek fat here. So it passes through, you can see the lateral orbital thickening, the zygomatic cutaneous ligament, the buccal-maxillary ligament, the nasolabial fat, the jowl fat, and the masseteric cutaneous ligaments. So with one thread into the multi-layer technique of the Mermaid technique, we can engage multiple structures, and using the contracture effect of threads, the tendency to straighten itself, we get a fantastic immediate lift. So this is a technique. So look closely. So we go deep first, and then we go subdermal, and then we do a hook into the layer 2 fat. We drape it up a few times, pressing it down onto the hooks. You can see that immediate lifting at the nasolabial area already. You can see that. Okay, cut it. Next thread. So you see I aim it downwards, layer 2 first, and then after I penetrate, and then I go to layer 2 again, and then I go a hook at the end of the, near the layer 2 fat pad at the end. Again, the draping part is very important. Make sure the tissues are all bunched up onto your hooks. And that way you get an immediate lift. So you can see the nasolabial area is totally lifted now. Okay, next to the jaws. Okay, so how do we anchor that? We can use the anchoring by using a collagen stimulator. So we can inject it into the temporal area where the threads would be. And if we can even use the knot to fixate it into the temporal fossa, if the thread that we use are thinner. So take a look. So this one, I'm demonstrating a collagen stimulator fixation. So we know that collagen stimulators create a fibrosis effect. It recruits the macrophages and, the fibroblasts, and it stimulates collagen production. So we want that collagen to be around the threads, and that causes like a sticky effect at the area where the threads are located in the temporal fossa. Okay, so this is the result of the Mermaid technique. So this side, the patient's right side, our left, we can see that there's a nice contour here from the chin to the cheeks. So you can see the reduction of the nasolabial fold and the reduction of the jowls. And for PLA cones, same thing, one entry point, and then two sides of the thread, of one thread into the nasolabial area, and then two into the jowl area. Let's take a look at the video demonstration. Same thing, go deep first, then go superficial, and then hook it at the end and come out. Okay, cut and then drape the tissue over the cones. You can see an immediate tightening effect here. Take the other arm and go down. Pull through, and you can see, drape it out. Remember, this is an important step. Yeah, look at that. Look at the lifting of the cheek area and the reduction of the nasolabia. Then we go to the jowls. Okay, so you can try this. If you put it in layer 2, you will not get such an effect. So you know that you are in the right plane, or rather the right planes, if you actually get an instant result like this. Okay, deep, superficial, and hook it at the end. And drape it. Nice. Okay, so let's take a look. So I did a half face for this lady. Take a look at the increased contour here, the V-shaped contour, reduction of the nasolabial fold, the reduction of the jowls, and in comparison to the other side, which is not treated. Okay, so, okay, let's pause it here. So take a look. So this side of the face is more lifted, more contoured. And interestingly, I have not treated the eyebrow, but you can see that there is a lifting of the lateral eyebrow area.